I know, Phil, you and Kirby both would agree with me during these crazy times. It's always nice to hear from friends, especially when, they could use a little shout out or a little help getting the word out. Our good buddy, Jonathon, Lyon, President and CEO of the Health Sciences Center Foundation's on the line with us. John, always nice to talk to you, even under the circumstances.
Great to hear your voice, and thanks for all you guys are doing.
Listen, we want to thank you guys for everything you guys are doing, especially on the front lines. Love this program you've put together called Feeding the Front Lines. It's an initiative where people like everyday people can donate to support and get some meals and hotel programs out to your frontline people. I know Earl's Restaurants and Tina Jones and her family over at Banville and Jones did a wonderful thing the other night.
Yeah, we, the situation is arising in this pandemic where it's really difficult to get people who work at HSC. There's over 8,000 employees. It's hard to get food in because of infection prevention and control, and they want to make sure because the virus can spread through various channels. So they have limited options to eat within HSC and a limited ability to get packaging into HSC. So we were approached by the hospital to say, well, how can you help out? So we thought the best way to help out on a sort of grander scale, because you don't want to turn anyone back, is to say, well, let's feed them. So Earl's approached us, and we began a collaboration, which the first night was Tuesday night. We delivered 550 meals, and all of them were spoken for. And we're going to be expanding this on Friday night with over 750 meals, and look to expand this for the next few weeks to support our frontline heroes at HSC.
So the best thing we could do to donate some cash towards that fund?
Yes, if we have the COVID-19 Crisis Response Fund on our website at hscfoundation.mb.ca, and we'd ask Manitobans, who are also appreciative and thankful for those people on the front lines who are there for all of us, to make a donation of any kind to support this effort so that we can carry on with this program.
Wow. And any donation is going to help some cause because you guys can spread out the money how it needs to be spread.
Exactly, and this isn't the only thing. This is one of the initiatives we first started with some patient-centric efforts to ensure that we had iPads in the ICU because, of course, there's no visitors, so you've got patients who are isolated.
That's huge.
So we wanted them to be able to communicate with their families, so we did iPads first, and then we turned on telephones, TVs, and internet in over 400 hospital beds for 3 months. And all of these things cost money. And that's where, so it's not just feeding the front line. There's also patient-centric initiatives and other things that we're doing to help support the men and women who work in the hospital and who also are in the hospital.
Yeah, you certainly got to feel for people that have family in hospital right now on both sides of that as well. Mm-hmm. Crazy.
Yeah, it's listen, this is not a great time, and it's a difficult time for everyone. So we're just trying to help lighten the load and make it better for our patients and for those who care for them.
I love this one, too, on the phone with John Lyon with the HSC Foundation, and you guys making hotel rooms available for frontline healthcare workers who need to rest and wash between shifts before going home. That's massive.
Yeah, that was another one that was brought forward to us by the emergency department, where there's concern again, wanting to, they're truly on the front lines of it in the emergency department at HSC, and so that is exactly it. Give those doctors an ability to shower, change, have a rest before they go home to their loved ones, because of course no one wants to transport any infection home with them. So that's something we're doing, and we're going to be rolling that out to include nurses and others at HSC in short order.
And that's in partnership with Canada. And John Lyon, thanks for doing this with us this morning. And you guys are just doing fantastic work there with the Health Sciences Center Foundation.
Listen, I appreciate the opportunity. It's great to hear your voices. Thanks for this. And again, encourage all Manitobans to continue to support our foundation so we can support the front lines and the patients who rely on them.
Tremendous, John. Thanks a lot. And we'll throw all that information up at the Power Facebook page just in case you missed it.